Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh. Hello, this is my first time going live, gang. I'm excited for those of you that are on, and we are going to get started. We're going to be talking about body imbalance, and I'm Charlotte Johnson, your host. We are going to be talking, let's talk about your eustachian tube. Now, I know many of you are wondering, what in the world is a eustachian tube? Well, I'm glad you asked. I'm glad you asked. And for those of you who already know what a eustachian tube is, and the reason you might know is because you have been following me on Facebook and you've been following me. You have subscribed to me on my YouTube channel. And so I'm all excited. I'm all in on this. I'm going to kind of wait for some of you to join in. I want to thank God for my TikTok family. I had started out doing TikTok, and a lot of you all are looking at my videos that I'm working it out. I'm trying to work it out and trying to get some things together. So we're going to start talking about the eustachian tube. Let's go a little bit over the anatomy. I always like to refresh for those of you that are new to body imbalance. You know what I'm all about? Let me tell you what I'm all about. I'm all about helping you as the patient, the consumer of medicine. I'm all about helping you understand the things that your doctor doesn't always have time to tell you. It's a lot of things. It's just really chaotic and busy in the office. And so sometimes we don't have the time to take and expand on whatever the diagnosis is. We can tell you what the diagnosis is. We can tell you the medications and what you're going to need to get you better. But sometimes we just don't have time to explain to you exactly where it's at and how it's happened and all of that. Well, that's what I'm here for. I am here to make it happen. I'm here to open up that door and let you know what's going on. All right. So the first things we're going to be doing is sharing with you about the structures and the location of your eustachian tube. So on this picture, some of the things that we're going to be talking about today is for an overview of the anatomy and the function. We're going to talk about that now. We'll look at it a little bit. We're going to review it again on the next slide, I believe. And then we're going to talk about causes of bilateral or both sides. Bilateral means both sides. Unilateral means one side. And that would be either we pick it's the left side or the right side. But when we say bilateral, it's both of them. What causes eustachian tube dysfunction on both sides? And then we're going to talk about some of the clinical presentations. You may not have understood what was happening to you, but I'm going to share with you what those signs and symptoms are and what test we do. We're going to talk about the diagnostic test. Then we'll talk a little bit about treatments. Unfortunately, There's good news and there's some bad news. I'm going to share some of the good news is there are two types of eustachian tube dysfunction, two different types that you will learn on this video and this episode today. And that first one is called obstructive. Obstructive. Just from the name, you can tell it's something blocking or obstructing or keeping the way, keeping it from happening for you. Want to make sure that I'm live on where I need to be live at. Yes, I am. Okay, so I am live on both Facebook and also on my YouTube channel, which my YouTube channel is Body in Balance 25, Body in Balance 25. Okay. The next thing we want to do, let's go on to follow the next slide. So you look here where it is in yellow. There's two different things that's happening here. You'll see the ear, the auricle on the outer side, the outer ear or the auricle. Then you see the ear canal. That yellow stuff over the top is the fatty stuff. That's what we talked about in the last video when we were talking about earwax and how it's made and things like that. Then you have that little blue object right there. That's your eardrum that separates the middle ear from the inner ear or from the outer ear. Then inside or behind that eardrum is your middle ear. Off that middle ear is a tube. That's called your eustachian tube. Now, on this video here, part of that tube is highlighted in green. Part of it is highlighted in green. The other part is highlighted in yellow. The other part is in yellow. The reason I did that is because, as it says, the eustachian tube is composed of both a bony portion, which is the green yellow or green blue looking part that's very close to the middle ear. And the area that is cartilaginous or made of cartilage and is kind of floppy is the yellow part that I highlighted in yellow. So I'm going to go back to the first slide and you'll see the eustachian tube where it's all red and angling downward. That angles down and it leads into the back of your nose. Into the back of your nose. You'll see that. You have to see this so that you can get a better understanding and a good feel for it. So when this area starts to narrow, that eustachian tube, that's when it feels really like your ear's all plugged up. So it connects to the middle ear and the what's called the nasopharynx or the back of your nose. It's in the nasopharynx and the back of your nose. So that being said, it keeps pressure from building up like a pressure cooker. It keeps it from building up. Now, the function of that is to equalize the middle ear pressure and to keep drainage from staying in the middle ear, causing ear infections or middle ear infections. So that's actually what the role of that is. And we'll talk about this at this point, the role or how the normal physiological role of the ear tube is. The tube opening mechanism, it helps when you swallow. That's why when you're on an airplane and it gets really muffled, swallowing, yawning, and chewing gum helps to balance that middle ear effectively. Now, when you have that middle ear ventilated, that's what that eustachian tube does, is to help ventilate the middle ear, preventing a lot of fluid from building up, which makes you have what is called a middle ear infection. That's what we talked about, about 4 weeks ago, about middle ear infections. And that's why you have to put tubes inside the ear drum to make another hole. So the hole that God stuck in your head back behind your nose, if it's not working, then we can put a tube through the eardrum to help you so that you can equalize the pressure. It's also important for helping you correct that ear pressure so that you can hear better, and it makes your balance a little bit better. Now let's move on to talk about some common causes of eustachian tube problems. From now on, you're going to see ETD. ETD. ETD stands for eustachian tube dysfunction. So I'm going to say common causes of ETD or eustachian tube dysfunction. One is allergies. That's usually the key because it causes a lot of inflammation in the inside of the nose. And when it causes a lot of inflammation inside the nose, there's swelling there and it blocks off that eustachian tube opening, the bottom part of that opening in the back of the nose. Allergic reactions can cause that and make you sneeze and have a lot of drainage and inflammation or swelling. Infections. So when people get COVID, one of the things that would happen is your nose would get all plugged up and you would feel like you were on an airplane. You would feel like you were riding on an airplane because it was so stuffy. It would be so stuffy. And so to prevent that from happening, we do things like I said, swallow or blow the nose, pinch the nose, and blow through the nose. Because when you do that, it tends to open that floppy tissue. Think about it's kind of floppy, like when you go by the car dealerships and you see that thing that flops all over the place where they're putting air in there and it's blowing up and it's flopping all over. That's the way the eustachian tube kind of flops around. And so when it needs air pressure in there, if you pinch your nose and blow, that will open it up. So you want to make sure it's not real narrow. Upper respiratory infections block it. And it can do that on both sides. COVID was a key problem for not just your nose, but your ears, for those of you that did get COVID. Praise God, you made it through. Made it out all right. You made it out all right. All right, here we go. We're going to move to our next slide. And we're going to talk about some anatomical things that can cause the symptoms. Well, anatomical risk factors. Children, those of you that have children that have Down syndrome, it is very common because their eustachian tubes, see where that red arrow is, that opening to the back of the nose? Their eustachian tubes stay more flat because of the shape of their skull. When it stays more flat, it tends to hold that fluid. It doesn't allow it to drain well. So therefore, there's problems. Structural differences like a deviated septum. If the nose is crooked, what splits the left side from the right side of the nose, that's called the septum. And if that nasal septum is deviated more to the left or to the right, it puts less room on one side of the nose than it does the other. It makes the turbinates move over and swell up, and then you have obstruction. Another issue is, if you look at my slide, you can see in the back there where the green box is. That's where adenoid tissue would be. Now, if you are a child, kids between the ages of 2 and 2 to 15, about 15 years old. That area can be very large. Now, that's when you're 15 years old, it's starting to get smaller and become like an adult, so that there is no enlarged tissue back there. But if you are a 3, 4, 5-year-old, 6-year-old, or you are always sick and going to those childcare centers are notorious for kids getting nasal congestion, ear infections, and that kind of thing. That's happening. Then we have to look, take a scope back there to see if the adenoids are large. That also causes a lot of snoring. That's another subject that we'll be talking about next week. We'll be talking about nasal congestion and sleep apnea or snoring. We'll talk about that and how it affects the nose and the ears. So, what kind of common causes outside of the enlarged adenoid tissue and a deviated septum? There are some disorders that will affect your eustachian tube. Chronic sinusitis, it impacts it, especially if you develop nasal polyps. And nasal polyps are little growths that will occur from the inflammation, from the chronic inflammation, from allergies and things like that. It looks like a peeled grape, like if you take the peeling of a green grape or a purple grape and you peel that off, that pulpy look to the piece of fruit is what it looks like inside the nose, like somebody shoved one of those up inside the nose and you would see it. It looks like a peeled grape. So chronic sinusitis will change the mucosal health. That all this area that's nice and pink, that's called the mucosa. And it will change the health of that. That increases the risk of the eustachian tube being blocked from inflammation. Right where that red arrow is, and you see that little slit under there, that's the eustachian tube opening, which leads right back to the middle ear. Gastrointestinal reflux. If you have really, really bad reflux, so bad that you can't lay flat at night because it feels like stomach acid is burning the back of your throat or coming up into your throat. Well, if it's coming up that high and you snore, it's subject to, or you are subject to, snorting that stuff into the back of your throat. And stomach acid is not to be found in the middle ear, in the eustachian tube, in the back of the nose, in the throat area. It will cause infections and it will irritate the mucosal lining. It will cause problems and make it distorted. Either it will swell it up or it will scar it down. I told you about children that have Down syndrome and those that have cleft palates. A cleft palate are the kids that have, where they've had surgery here, because your skull is two separate bones. You've got a left side and a right side, and they come together, and this would be called like a suture. So there's a line there. That line, if that's opened up, if you take your tongue right now and rub it inside at the top of start from your teeth and go as far back as you can. Just take your tongue and rub it from your teeth to as far back as you can. You'll feel there's a line there. That line is where sometimes it doesn't close all the way and you get what's called a cleft palate. That's a setup for some predisposition of eustachian tube dysfunction. So what are the symptoms that you have? Symptoms of eustachian tube dysfunction. Now, you may not have even known that you had eustachian tube dysfunction. You may not have understood what was going on. All you know is you had ear fullness. It felt like something was inside your ear. You didn't know why. Well, Now we know that it could be because you have eustachian tube dysfunction. So if you're feeling that way, you need to see your friendly ENT provider. A feeling of fullness in the ear, pressure in the ear, if there's muffled hearing. So it's not like you have really bad hearing, you just can't hear, but it feels like you're in a bucket or you're underwater or you've got a cold or something like that constantly. Muffled hearing, dull hearing. It's rare, but sometimes you can have some tinnitus or ringing in the ear. I'm going to skip over the red one and we're going to go over to discomfort and popping sounds. Like it'll be like there's a pop or a click inside the ear. There's that happens a lot and people don't understand why. And if you pinch your nose and blow, it'll pop and then you can feel relief for a few seconds because it's like that thing I was telling you that flops all around. For 1 second, it's back. The next second, it's this way. The next second, it's that way. And that way, and all that moving around, that's what happens when the eustachian tube is really floppy like that. So balance disturbances. Sometimes you can get some mild balance disturbances, not that real room spinning sensation, but it's a pressure and it doesn't, when it's not equalizing. Let me tell you, if you have this and you've ever had a really nice day and you just chilling and you just riding in your car, enjoying life, and you say, you know, I want to get some fresh air. It's a nice spring day. I'm going to let the window down. And it's only you in the car, so you let one window down. And all of a sudden that air starts rushing in to the car and your head feels like it's going to explode. Because you don't have a eustachian tube that functions correctly, it feels like your head is going to explode because you can't equalize the surrounding pressure around you, just like when you're in the airplane. So you've got two choices. One, roll the window back up. That will equalize the pressure to what it was before, that your ear could handle it. Or roll the other window down so that the environment around you gets equalized and you don't have to you don't have to end up depending on the eustachian tube to work. So now let's talk about autophony. You remember I told you there were two types of eustachian tube dysfunction: obstructive and patulous. The obstructive, there's treatments for that. There's some fairly helpful treatments like antihistamines, nasal sprays, prednisone will help with fixing that. The other one, called patulous eustachian tube dysfunction, is much like, let's describe it when you get a 6-pack of sodas and you can pull a can out and put it back in if you decide you don't want to drink it, and pull it out, pull it back in if you decide to drink it, pull it out and hand one to somebody and then pull it out, and then somebody's not there. Anyway, you keep pulling it out. After a while, that can holder stretches. And when it stretches, it no longer functions like it's supposed to. That's what happens to the cartilaginous part of your ear when you are having patulous eustachian tube dysfunction. So it's not an obstruction, but it's the fact that it just doesn't close when it's supposed to. It doesn't monitor the environmental factors and function like it should when you go up into the mountains, when you are going up in an airplane or coming down in an airplane, when you roll one window down. Whenever you have sudden pressure changes, there's a problem. Now, how do you know you have patulous versus obstructive? Well, I'm glad you asked. Autophony is when you can hear your own voice real loud. when you're eating a bag of Lay's chips, you can eat some chips and it really doesn't bother you. But people that have patulous eustachian tube dysfunction, it is loud. That loud crunching, eating food, eating celery, biting an apple. All of that is really, really super loud. Sounds are hypersensitive. You become hypersensitive. People that have these problems, it's called autophony. That's patulous eustachian tube dysfunction. And it is very difficult to fix, unfortunately. So let's skip over to how do we determine what's what. I'm going to put up a slide here. So you have 3 types. Those of you who have been following me pretty good, we did audios and we talked about audios, and you have 3 types of tympanograms. One, you'll have a flat line instead of that mountain peak there. But see where the 0 is? The 0 on that, if the mountain peak was over that 0, that's a normal tympanogram. That's a type A tympanogram. If it's a flat line across there, that's a type B tympanogram, which usually indicates there's fluid in the middle ear. If you have it pulled backwards, see the negative numbers back here? If you have negative numbers, that's negative pressure in the middle ear, meaning that the eustachian tube is not functioning and it's doing just what I told you that those irregular, dysfunctional eustachian tubes do. So you can see there are 3 tympanograms at the bottom. So let's go up to the otoscope exam. We'll do an otoscope exam when you come in. First thing I want to do is look in your ear. I want to make sure there's no wax, and then I can look in the middle ear, shining a light in there. I can see if there's any fluid in there. I can also see if the eardrum is pulled backwards. You know how when you go after Thanksgiving and you're having a great meal? That's why I love Thanksgiving, because my sister-in-law and her kids, her 2 girls, are the bomb diggity cooks. And so when we're all done eating, everybody's done grazing, we go and all the ladies go in there and gather around and put saran wrap tautly over the foods, and we stick it in the refrigerator. It's nice and taut, kind of like an eardrum. But then when you go back 3 hours later, there's condensation, and that taut saran wrap is now sunken. It's sunken into that bowl. That's kind of what happens with the eardrum. It pulls backwards. And so that's how you get the type C temp. See the one that I have circled in red? So type A is the normal one at the top, where the mountain peak is right over the 0. Type B is where it's flat, and type C is where it's pulled back. So the tympanometry assess the middle ear pressure, which lets us know if the eardrum is working correctly. Now, what I want to do, remember I told you that we would slide a scope. We take a scope and we spray your nose, numb it all up real good. We spray your nose, go through, and we slide it under that inferior turbinate and get right back there in the back of your nose to look to see what that opening looks like. That's how we visualize that. I just talked to you about the 2 types of eustachian tube dysfunction. I told you about what happens. Some of the things I want to talk about with you, patulous eustachian tube dysfunction, is it's an unknown cause, but it's associated with a lot of different things. People that lose a lot of weight. It's one of the things, if you lose a lot of weight, this can occur because all that tissue was stretched, and now when it comes back, when you lose a lot of weight, it doesn't function like like the can holders that I was telling you about. Hormonal changes. So when women get pregnant, sometimes this can happen. through the pregnancy. And then many times it may go back where it's not so bad, but some people still have problems. Excessive gum chewing and blowing your nose really hard. Those that just go to town and blow your nose real hard, like you're blowing a trumpet, that's not real good. You don't have to do that to clean your nose. If nothing's coming out, don't try to keep blowing because you will disturb your eustachian tube. TMJ, jaw pain. That's another thing that we're going to be talking about in our upcoming, I think I have 2 more that we're going to do on the ear. And that is for the snoring. That's kind of ear, nose, the snoring I want to do, and the TMJ. Medications like diuretics tend to cause problems with the eustachian tube, taking out a lot of the fluid. So the elasticity of that eustachian tube does not function, the cartilaginous part of it. And neurological issues such as nerve problems, strokes, and that kind of thing. I talked, and obstructive, in the obstructive, we talked about the adenoids, but then also I slide that scope back there because we want to make sure that a person doesn't have a tumor or a growth, especially a nasal tumor in the back of the nose, especially if, remember I told you about bilateral eustachian tube, especially if it is unilateral. You want to make sure that there's no problems. We have come to the conclusion, and for the conclusion, I want you to understand that bilateral eustachian tube dysfunction frequently occurs and can often go undiagnosed. People may not know what it is. So now even providers may not know, your regular doctor may not know that it's a eustachian tube dysfunction. But now you can gently bring it up if you have the symptoms that I talked to you about. You can always go back, go over my slides. You can go on to Body and Balance 25, and you will find this in the playlist for ears and ear problems. And you can get the signs and symptoms, and you can talk to them about it if you've been having problems like we discussed today. The condition significantly can affect your health overall. Those of you that have patulous eustachian tube dysfunction, it can really bother you, especially if the noise is loud and your chewing is so loud, and it's very little to take care of that. Now, I want to bring up, there is, let's see, I'm not sure I can play this video for you. I don't have that video to bring up, so let me see if I can bring it up real quick. Video file. Hey, great. This doctor is a doctor that
I'm Dr. Joseph DeBartolomeo from Santa Barbara, California, and I've been working on the patulous eustachian tube disorder for at least 10 years. My incentive was having the condition myself and being told that there was no treatment for it. As a result, I applied to the Food and Drug Administration, received an IND, and studied it for 10 years. The eustachian tube is normally closed and only opens passively 3 or 4 times a minute, with swallowing, yawning, or chewing sometimes. Unfortunately, the patulous eustachian tube is confused with nasal congestion, allergies, colds, and hay fever. And the doctor that examines a patient is told that the patient's ear may feel stuffy. That's a generic symptom. It may mean a closed tube or an open tube. If the doctor sees fluid behind the ear, the patient most probably has the typical condition of hay fever, allergic rhinitis, or a congested eustachian tube. Eventually, we determine that the mechanics of a patulous eustachian tube are not a disease process, but a disorder of anatomy in which the various walls are not in synchrony. However, if the anatomy is perfectly fine during observation, the doctor is usually puzzled. But if he observes the patient breathing through a forced inspiration, like covering one nostril and the physician can observe that the tympanic membrane moves backward and forward in synchrony with respirations. And during that time, the patient may then complain of orthophony, or the ability to hear themselves breathing. We want to achieve that congestion of a normal tube, and we accomplish it by patulend. The problem initially in the patulous eustachian tube is that the eustachian tube sits in the back of the nose. And we want to get a treatment directed towards that will in effect close the eustachian tube. We developed a drug-free product after 10 years of research, which is effective in closing the eustachian tube in over 80% of the patients. However, the administration of the supplement is important in terms of the technique to administer it. The technique we will demonstrate is to lay the head back at a 45-degree angle and then turn it to the right at approximately a 45-degree angle, and to sniff the drops back until you just feel them enter the eustachian tube and you have a sensation reaching the ear. There's a stinging and sometimes a burning, but that stimulates the soft tissue to swell a little bit of local edema, and that will close the eustachian tube. But with abnormal anatomy, it requires the cooperation of the patient's otolaryngologist to guide them in delivering the nose drops to the eustachian tube. More than 80% of our patients find benefit within 1 month and do not have to take it again. If not, then they may want to consider other factors and the possibility of eustachian tube surgery. The advantage of patulend is that it is drug-free. It is a vitamin complex supplement that, when used properly, will enhance healing of the tissues for future improved function of the eustachian tube. It may take about 3 months in some cases to restore that tissue. Fortunately, the product patulend is drug-free and it's free of side effects as well. There are no allergy reactions to it, and it can be taken ongoing just as you would any supplemental vitamin for the tissues of the body in general. But this product, patulend, has been formulated for bioavailability of the nutrient and antioxidant properties through the mucous membrane of the eustachian tube to close it effectively and safely.
All right. So I want to thank Dr. Bartolome for coming up with that, because I'm telling you, there has been nothing out there, and that happens to be a good product. Now, there is no prescription for it because, as he said, it's not a lot of medicine. It's just vitamins. It is called Patulend, Patulend, Patulend. You can go online and order this medicine. You can go online and get it from Amazon, I saw, and you can put in Patulend drops. Again, Patulend drops. You can get that and start to use it and see how it helps. He says there's 85% of a cure rate for something where most people are going to tell you there's nothing we can do, because there really hasn't been anything until he started doing this. So hopefully that helps. And that can be a blessing to those of you that have patulous eustachian tube. The obstructive eustachian tube, we can do something about that. We can use nasal sprays such as Flonase, triamcinolone, Rhincourt, that kind of thing. We can also use, we can also put tubes in, but tubes for patulous eustachian tube has not been very effective. So I'm going to relinquish my stand. I just want to say thank you so much for joining. Those of you that have joined, thank you so much for those TikTok viewers. And I hope to see you on another Body in Balance. Hopefully, your horizons have been enlightening.